Let me show you, Tanima, what is happening here in the GTB hospital. On my left is the waiting hall where the people who will come for the vaccination, they will be sitting there once they come there. And after they come here, or after the registration is there, the verification process will take place here. This is, you can see, this is the COVID data that has been generated here. This is the list of 25 healthcare workers who are present today for the vaccine dry run. On this side, you can see the vaccination center is there, where inside the vaccination is being given. This is the placebo which is being currently given to the healthcare workers. And on my left here, if you see, this is the adverse effect monitoring center. This is also called as the observation room, where we can see these healthcare workers. There are 25 of them are being administered. In fact, I've got a person from the hospital. Ma'am, आपको वैक्सीन लगाई गई है. Adverse event में क्या कुछ किया जाएगा, यहाँ पे क्या बताया गया है?
अभी हाफ एन आवर वेटिंग रूम में वेट करने के लिए बोले फॉर ऑब्जर्वेशन.
Okay. And ma'am, through this entire process, you were the one who has been given the placebo as well.
Yeah.
Placebo you have received.
Yes.
And what is the process after administration of vaccine? What has been told to you people?
आधा घंटा तो हम ऑब्जर्वेशन में रहना है. उसके बाद इफ आई हैव एनी प्रॉब्लम देन आई कैन.
They will be taking you to the hospital.
Yeah.
Okay. So that's the process, Tanima. Basically, this is the part which is very, very critical, and that is why the dry run is being conducted. Adult vaccination is something very important in a large chunk. 30 crore is there in India, and that is why it is very, very important to ensure that people who get adverse effect need to be monitored properly, and that is why we are seeing the dry run over more than 200 sites in India.
With us, I'm also joined by our reporters who are spread out across the country covering the vaccine dry run today. Let me also go across now to Shrija, who's joining us from Bengaluru. Shrija, has the vaccine dry run started? And also the healthcare workers who are present over there, they are of course involved very deeply. There are 25 healthcare workers who have been selected to be part of this dry run in each of the sites.
Well, that's right. In fact, we understand that the dry run has already started where we are, in fact, reporting from, which is our Kamakshi Palya Primary Health Center. And to give you an idea exactly how it is taking place, what we see here is that there are some of the healthcare workers who are with us, joining us, and they have received a message from the Karnataka Health Department. The messages that you are looking at talks about that the timings that they have been given, at what particular time they are supposed to come at the primary health center for the vaccination, and their name that has been registered. Now, once they step into the primary health center, now their job is to show this particular message to the person who is sitting over here. Now, they have so far, what we understand is that registered at least 15 people out of 25 is what we have been told. Nearly 15 people have already come in for the vaccination, and remember, the dry run has already started. Now, if I could go across to a couple of people to understand what really do they feel and think about as far as the messages that they have received, that they are also taking part in the dry run. Madam, ಯಾವಾಗ ಮೆಸೇಜ್ ಬಂತು?
ನಮಗೆ ಬೆಳಗ್ಗೆ ಬಂತು ಮೇಡಮ್ ಮೆಸೇಜು.
ಹೇಗೆ ಅನಿಸ್ತಾ ಇದೆ ಈಗ ಡ್ರೈ ರನ್ಗೆ ಸೆಲೆಕ್ಟ್ ಆಗಿದ್ದೀರಾ?
ಏನು ಖುಷಿ ಆಗುತ್ತೆ, ಯಾಕಂದರೆ ನಮಗೆ ವಾರಿಯರ್ಸ್ ಆಗಿ ಕೆಲಸ ಮಾಡಿದ್ವಿ. ಹಂಗಾಗಿ ನಮಗೆ ಮೊದಲು ಪ್ರಿಪ್ರೇಷನ್ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ ನಮ್ಗೆ ತುಂಬ ಥ್ಯಾಂಕ್ಸು. ಮತ್ತು ಈಗ ಫಸ್ಟು ಇಂಜೆಕ್ಷನ್ ರೂಮ್ಗೆ ಕಳಿಸಿದ್ರು. ಫಸ್ಟು ಅಬ್ಸರ್ವೇಷನ್ಗೆ ಇಟ್ಟರು, ಆಮೇಲೆ ಇಂಜೆಕ್ಷನ್ ರೂಮ್ ಕಳಿಸಿದ್ರು. ಇಂಜೆಕ್ಷನ್ ಆದಮೇಲೆ ಮತ್ತೆ ರೆಸ್ಟ್ ರೂಮಲ್ಲಿ ಕಳಿಸಿದ್ರು. ಮುಗೀತು. ಒಂದು ಹಾಫ್ ಆನ್ ಅವರ್ವರೆಗೂ ಅಲ್ಲೇ ಇದ್ವಿ. ಅಬ್ಸರ್ವೇಷನ್ ಏನಾದ್ರು ತೊಂದರೆ ಆಗುತ್ತಾ ಅಂತ ಎಲ್ಲ ಸಿಸ್ಟರ್ಸ್ ಗಮನಿಸಿದ್ರು. ಏನೂ ಆ ಥರ ಏನೂ ತೊಂದರೆ ಆಗಿಲ್ಲ. ತುಂಬ ಖುಷಿ ಆಯಿತು. ಮತ್ತು ನೆಕ್ಸ್ಟು 28 ಡೇಸ್ ಆದಮೇಲೆ ಸೆಕೆಂಡ್ ಡೋಸ್ಗೆ ಡೇಟು ಇದು ಮಾಡ್ತಾರೆ. ನಾವು ಆಶಾ ವರ್ಕರ್ ಆಗಿದ್ದೇವೆ.
Well, here the ASHA worker tells us, in fact, it's been at least about an hour she's come into this particular primary health care center, and also it's been half an hour where she was at the observation center. The entire process of getting vaccinated, where she was waiting, then vaccination, and after which where she was made to sit at the observation room is completely over. Now she's allowed to go. Now remember, this is a similar kind of a run which has been conducted here across nearly 5 districts in Karnataka. If I could go across to another healthcare worker over here. ತುಂಬ ಜನರು ಅವ್ರು ಹೇಳ್ತಾ ಇರೋದು ಈಗ ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೊಂಡ್ರೆ ದೇರ್ ಆರ್ ಇಶ್ಯೂಸ್ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಆ ಥರ ಏನಾದರೂ ನಿಮಗೆ ಅನಿಸ್ತಾ ಇದೆ?
ಇಲ್ಲ ಮೇಡಮ್, ನಮಗೆ ಯಾವುದು ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಏನೂ ಆಗಿಲ್ಲ. ವ್ಯಾಕ್ಸಿನೇಷನ್ ಹಾಕೋಸ್ಮೇಲೆ ಚೆನ್ನಾಗೇ ಇದ್ದೀವಿ.
ಸೊ ಎನ್ಕರೇಜ್ಮೆಂಟ್ ಬರ್ತಾ ಇದೆಯಾ?
ಇಲ್ಲ, ಏನು ಬರ್ತಾ ಇಲ್ಲ.
ಓಕೆ, ಎಷ್ಟೊತ್ತು ಜನ ಈ ಥರ ವ್ಯಾಕ್ಸಿನೇಷನ್ ತಗೋತಾರೆ?
ಈಗ ಒಂದು 20 ಮೆಂಬರ್ಸ್ ತೊಗೊಂಡಿದ್ದೀವಿ. 20 ಮೆಂಬರ್ಸ್ಗೂ ಯಾರಿಗೂ ಏನೂ ಪ್ರಾಬ್ಲಮ್ ಆಗಿಲ್ಲ.
ಟ್ರೈನಿಂಗ್ ಕೊಟ್ಟಿದ್ದಾರಾ?
ಇಲ್ಲ ಮೇಡಮ್, ಟ್ರೈನಿಂಗ್ ಏನಿಲ್ಲ.
Well, she's also yet another ASHA worker who's telling us that the dry run has almost started like about a half an hour ago, and of course she has gone through the entire process and she is ready to also undergo the entire process of vaccination. Remember, there have been several misconceptions here as far as Karnataka is concerned. During the first phase of the trial, the second phase of the trial, those who had, had gone through the entire human clinical trial, they had come out in the open talking about the kind of issues, and of course we did see how even Medical Education Minister and the Health Minister of Karnataka, Dr. K. Sudhakar, he did of course talk about that yes, there can be side effects and that is something to be looked at. And as far as the dry run is concerned, remember this is the exact room where the entire exercise is taking place, and of course there are 25 people now. This particular primary health center is still awaiting 10 more people to undergo the entire dry run.
Right, Shrija, thank you so much for joining us. With that, stay with us. I'm also joined by my colleague Mugilan, who's in Chennai. Mugilan, like Shrija and Ayushmaan were pointing out over there, that the dry run exercise has in fact started across the country today in over 250 sites where the dry run is being conducted. In Chennai also, that you are coming to us live from, what is the situation at the moment? Has the dry run begun, or anything that you're picking up in terms of the dry run exercise being conducted in Tamil Nadu?
Definitely, yes. The dry run has just begun here in Chennai, and you can see the frontline workers are being made to stand here in queue. And this process, this entire vaccination program, is app-driven. So they have to authentic online. They have to give the unique ID. They have to get registered. They has to be get authenticated. And you can see the ASHA worker who is sitting here, and she has provided her unique ID to the registration staffs here. And after confirmation, she will be sent for the vaccination here. So the officials here say to ensure that there is no duplication or any malpractices, and that is why this entire program is being run through app and internet. And you can see the doctors also, enough number of doctors also being stationed here at the dry run centers, because once after the vaccination is done, they will be made to wait here for at least 30 minutes for observation. And we are joined by a few doctors here. Doctor, what will be your observation once after the vaccination is done to a patient or a person? What all will you be looking for?
Yeah, we'll first look into the adverse drug events, anything is happening. Then we'll try to monitor for half an hour after the vaccine has been given. We'll try to monitor everything as early as possible.
So you heard from the doctors also. They also say that they will be looking for the vitals of the patient. They will be looking whether there is any complications they develop, or any allergy they develop to the vaccine. And we are joined by a few staffs here. நீங்க எவ்வளவு மணி நேரம் வெயிட் பண்றீங்க? நீங்க வேக்சின் ப்ரோக்ராம் வந்ததுக்கு அப்புறம் நீங்க கண்டிப்பா இந்த வேக்சின் எடுத்துக்கிறீங்களா?
கண்டிப்பா எடுத்துப்போம்.
நீங்க என்ன ஃபீல்ட்ல வர்க் பண்றீங்க? எவ்வளவு நாளா இந்த கோவிட் ஃபீல்ட்ல வர்க் பண்ணீங்க?
நான் ஒரு 2 இயர்ஸ் ஒர்க் பண்ணுறோம். இங்கே மென்ஸ் ஹாஸ்பிட்டலில் ஒர்க் பண்ணுறோம். ஒர்க் பண்ணிட்டு இப்போ இந்த கோவிட்-19 தடுப்பூசிக்கு எங்களுக்கு கூட்டின்னு வந்தாங்க. வர
So we heard from him also from the day one. He is being working during this pandemic period, and now he is very much eager to get vaccinated also. So this is a kind of enthusiasm what we could learn from almost all the workers who have been come here for the dry run. They are very eager to get vaccinated for the COVID.
Right, Mugilan, thank you so much for joining us. With that, I'm also joined by my colleague Mayuresh, who is coming to us from Mumbai, but it's essentially not in Mumbai, but in other parts of Maharashtra, where locations have been chosen for the dry run. Mayuresh, this is probably one of the states which is also testing out locations where probably the resources are not the best. Probably it's a bit more harder to reach than other locations. We've seen other state capitals are involved, but that's not the case that Maharashtra is trying out. They're actually trying out areas which might face last mile issues.
Absolutely, and the reason was given that the Mumbai is overburdened with many other things, including the COVID protocol. That's why they have not chosen the Mumbai. But apart from Mumbai, Pune is there, Nagpur is there, and two, we can say the remote district. We can say one is Jalna and another is Nandurbar, which is a tribal district that has also been chosen. And already the vaccine exercise, or we can say the dry run, has already started there. 7.35 lakh healthcare workers have been identified by the state government, and they are hopeful that all these 7.35 lakh health workers in first phase will get this dose. But Anima, interestingly, where right now I'm standing, you can see behind me, this is the building, and this building is basically very much important, and it will get that importance soon, because this is the building where on first, third and fourth floor the vaccine will get stored in Mumbai. This is a Kanjurmarg facility, or we can say a facility in Kanjurmarg by the BMC, and this would be one of the largest and the biggest storage center in Mumbai, because once this facility comes into the play, BMC will be able to store somewhere around 50 lakh vials of the vaccine. Right now the capacity of the BMC is somewhere to store 5 to 7 lakh vials of the vaccine in 8 different medical colleges. But once this facility comes into play, it will increase and it will reach to the 50 lakh vials that BMC can store. Also, BMC had already is in touch with the Mumbai police for the routes as well as how to clear the traffic, because the transportation would be the key. This facility where right now standing is in Kanjurmarg. It is nearby highway. Once the vaccine comes, it will get stored here. But from this place, it has to reach at all these 8 medical colleges which the state government and the BMC has decided. So BMC is in touch with the police department. BMC also said that even if we require to have a green corridor, we will have word with the Mumbai police and we'll ask them to issue or to give us that green corridor so that the vaccine can get transported easily and without any hassle.
Right, Mayuresh, thank you so much. Mayuresh, Shrija, Mugilan and Ayushmaan, who are covering the vaccine drive dry run. This is a mega exercise being conducted by states across the country today in order to figure out any last mile hurdles that they might face before the vaccine rollout.